All right, let's go. Hello, my name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. And you've seen me do these updates now for the past few months in conjunction with the leadership of the ACOI, and I hope these messages are helping you keep up with the latest of COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who focus on infectious diseases daily for a living, and certainly on behalf of the ACOI. So moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progresses that we are seeing. So let's go to the stories. So let's talk about vaccines. Vaccines are on everybody's mind, my mind included. So the question is, to be or not to be? Okay, so I'm starting off with a little bit of Shakespearean humor, since the FDA Advisory Committee has just reviewed the COVID-19 vaccine for emergency use authorization to determine if it shall be or not to be. Okay, but I'll use this pun as a lead-in to the fun story about one of the first people who got vaccinated in the UK, and that was none other than William Shakespeare. That's right. Well, I mean, not that one. But hang on, we'll get back to that in a minute. First, the FDA story. Now, the approval for emergency use was covered live on broadcast media today in a very transparent public discussion this week, which I'm assuming is part of the plan to help the general public be comfortable with the amount of due diligence, which was a lot, surrounding the decision to move the vaccine. I'm very happy to say that the initial panel, so the FDA presents the information to the panel. The panel actually gave their approval of the vaccine, which means now this is going to go to the FDA, who are most certainly going to deliver or approve for emergency use. Okay, so with daily deaths now more than 3,000 per day in the U.S., it is likely that after Christmas holidays, things are actually going to get worse. And if we thought Thanksgiving was a super spreading event, just wait for the aftermath of Christmas and what we'll see in January. I predict things will not be smooth until roughly February, and I can only hope that Valentine's Day doesn't spur another spike. Now that's one Cupid's arrow through the heart that we don't need. But for people like William Shakespeare, who is 81 years old, things are looking up. He's the second person in the UK to get vaccinated. Some are calling it the taming of the flu. These puns are killing me. I love it. But let's not forget that this is, of course, not a flu. But making this more interesting now is how calm Mr. Shakespeare was amidst all the vaccine fears, perhaps proving that to all that a large part of this was much ado about nothing. Got another one in? Okay. Another fun fact is that a modern-day Shakespeare received the vaccine just 20 miles away from the 17th century Shakespeare's birthplace. How cool is that? All right, but unlike the Dark Ages, the modern age of having a vaccine that was developed so quickly is, let's not forget, truly a major achievement, especially since we all know that they typically take years to develop. But interestingly, creating the vaccine may have actually been the easy part, while the hope is that the vaccine is the magic bullet that will bring the pandemic to a speedy end. That actually really isn't a realistic conclusion. There's a lot that needs to be done before we can take that collective sigh of relief. The things that can make or break a successful ending to this relies on three things. One, how quickly and strategically the vaccine is distributed around the country. Two, how well it's received. And three, whether people will continue to abide by other edicts like mask wearing and physical distancing, because that obviously is still going to be necessary even after we get vaccinated. What we don't know and what we suspect is that it's very likely that even though the vaccine will protect you from getting ill from COVID-19, from the SARS-CoV-2 virus, it's still likely that you can transmit the virus to somebody else. So hence the importance of continuing to wear masks. Now, having a pandemic hit in the U.S. this scale has obviously been unprecedented. Of course, we did see it in 1918. But getting the vaccine out and administered, well, that was a whole other feat altogether, an undertaking that is equally unprecedented. And the logistics of this thing are massive. Actually, think about the complexity of it for our public health system that has been broken and has been terribly underfunded. It is an immense responsibility. While we all want to be successful, the problem is first that we have a lack of clarity of health systems. Many are saying that they're not even sure which vaccines they will receive or even how many doses. And without that information, you can't execute any plan, no matter how great it looks on paper. So, like most things, when funding is short, the integrity of carrying out a large-scale endeavor is at risk. So what needs to happen immediately is that Congress needs to increase funding for state and local vaccination programs throughout the country. Now, another concern is that the mere idea of availability of a vaccine will send a false sense to the general public. And I'm afraid of people thinking that they can be lax about wearing masks or continuing to practice social distancing. It's going to be very important that we continue to do this through 2021. So that's where a well-executed, targeted communications campaign has to happen. Clear communications and messaging are crucial to make the most out of getting us through this massive effort of vaccinating a general population. Still, a lot of things need to be worked out. If you want to read more about some of those challenges, check out the Kaiser Family Foundation analysis that they published about vaccine distribution. One of the things that they point out is that only $200 million has been distributed to a state, territorial, or local jurisdictions for vaccine preparedness at this moment. But that is just a drop in the bucket, since it is estimated that at least $6 to $8 billion is actually needed. $6 to $8 billion. President-elect Biden has said that he and his administration actually want to invest $25 billion in manufacturing and distribution. That's good news. So for their analysis, what the Kaiser Family Foundation did was collect distribution plans from every state, since there's no central repository at the federal level with plans at this time. Shocked by that. The comment, to be or not to be, right? I'm shocked, right? The common themes they found were based on identifying priority populations for vaccinations in each state, identifying the network of providers in each state that will be responsible for administering the vaccines, developing the data collection and reporting systems needed to track vaccine distribution progress, and laying out communication strategy for the period before and during vaccination. A link to all those state plans is included in the ACOI resource pages. Please check out your state. Folks, this whole concept about vaccinating, the fact that we didn't know this organism a year ago, the fact that these mRNA vaccines, which was developed, and you're going to start hearing more about the 34-year-old immunologist who designed all this. I think she was 29 when she first started working at the NIH, Dr. Corbet, Kiesmiaki Corbet. And she's an amazing story. I have a feeling that we're going to start hearing a lot more about her, and I suspect, and I'm just shooting from the hip, but I think that we are going to be seeing a potential Nobel Prize. I don't know, I'm just saying it now. Hear me today, quote me tomorrow. All right, so stay on the lookout for our regular updates, which are definitely not much ado about nothing. These are very important. And to read more about the sources used in this report, go to the ACOA.org/COVID-19. Together with the ACOI, we will help you with the latest information to help you respond to your patients and stay on top of the crisis. Of course, as always, please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.